recording. Hi, everybody. Welcome to Medical Monday.
Yes, this week's topic is going to be hip bursitis. It affects women more than men, about twice the rate. About 15% of all women will end up with hip bursitis, and about 6% of men will have hip bursitis.
Yes, only 6% of men.
It is inflammation or pain in the side of your hip. Oftentimes, patients note it at nighttime when they're laying on their side. If you touch on your hip, that's where that pain comes from.
Yes, and it is usually point tender. Hip bursitis is typically easy to diagnose or know that you have it because it is very point tender. So if you push and it hurts, that's probably a type of hip bursitis.
And we get it from repetitive motions. So repetitive motions at St. George Hospital, actually a rheumatology department did this study talking about the repetitive overload plays the primary role in hip bursitis. And that's because the way the hip is, those muscles actually rub on certain things.
Yes, the muscles do actually rub on different things. And that it's the repetitiveness, squatting, different types of work positions, even at an office desk. They're just the repetitiveness of doing the same thing over and over again. If you think about sandpaper, it just keeps rubbing and rubbing and rubbing, and that area just gets inflamed and irritated because it can't recover.
It will rub your wallet, that's for sure.
That is a very
costly.
true statement.
So the cost of care in America for hip is about $140 million. That's just the cost of care. But the cost of lost work is more than that. It's at about $164 million a year.
Yes. Yes. Hip pain is significantly more costly in regards to the workplace.
So if it costs you more in lost work wages than it does for the actual procedure, and you know, some of these procedures like a hip replacement, it's $80,000. That could be, for a lot of people, 2 years out of work. So it's very significant on the amount of lost work.
Yeah, it's not fun.
Nope.
From either perspective.
I like coming to work. I like helping patients, you know?
And you know what, though? What is hip bursitis? Like, what is the bursitis, the birds?
The bird.
Yeah, bird. Yeah.
So bursitis is actually a sac that lies in between two muscle groups. So as they move, they have a cushion, and it also releases fluid so that those muscles move smoothly around each other.
There are actually 4 bursa in the hip area. So there's 4 on the left, 4 on the right. The most commonly affected is this big one right here.
That's on that knob on the side of your
on
leg.
the
When you
side
feel
of
the
the
side of your leg, that's what that bump is.
That is, absolutely. There's also one that we sit on.
Yep.
Yeah.
The 2 big muscles, your glute med and your glute maximus, are what rub the #1 cause of your bursitis to be tender.
Yes. And so Lonnie's head is actually covering up this beautiful gluteus maximus here. Yes. And then the medius is actually on the side of the hip. So the medius is what goes right up against that bursa. It helps to support the hip, hold it in place, and do specific movements. But those 2 muscles are very large culprits in regards to a hip
very large
bursitis.
muscles, and they're expected to do a lot. So they create a lot of friction and pressure.
All right. And then also you mentioned that it's to allow muscles to move more easily. This is a great visual of that. You can see the bursa here and that muscle.
That's that same bursa right on the edge of the outside of your leg. You feel your bone. That's a lump. It's greater trochanter, but what it is a lump on the side of your leg, and you can feel it actually.
Yeah, you can feel it. It's pretty cool. It is actually really cool.
Yeah. And that's why when you lay on your side, because of that pressure point, will cause pain at nighttime that patients oftentimes complain about.
This is literally right on the side there, right on the sides of your hips. So you can see when it's inflamed, it's irritated. If you lay on that, it is very uncomfortable.
Yeah.
And there's some other additional causes of hip bursitis.
Overload. Overload is the primary, but we look at some other conditions that can cause your muscles to dysfunction and rub inappropriately, such as scoliosis.
Scoliosis is actually a pretty large contributing factor. We've seen quite a few cases here in the office. And yeah, it's because your pelvis is unlevel, which is going to require muscles to work differently than they're actually designed to do. So yeah.
Another thing that can make you unlevel, like you talked about, is if one leg is longer than the other one. That's a bit of a stretch. However, you can see that it would make the patient walk very different and put more stress on one side.
Very, very true. Very true. That's a problem.
Yeah.
Which is the problem though? Is it the long leg or the short leg?
I think it's the short leg.
You think? Yeah, I thought the short leg was the problem too.
But you look at your foundation.
Yes, foundation. Your feet are your foundation. If there's an issue with the foundation of your house, you're going to see it in a lot of different areas. So if there's a problem with the feet, calluses, bunions, ingrown toenails, anything that's causing you to actually walk differently and modify things, it's going to cause problems. It
Plantar
truly is.
fasciitis,
Yeah.
everything that's going to be tender with your foot to where you're just not going to walk right is going to put more pressure, more strain on the opposite side of those muscles that are going to now press hard and give you a bursitis.
That is exactly what they do. That's exactly what they do. So what can we do?
There's a lot of things you can do at home.
Okay.
There's
good.
a lot of good things. Really, we think about the most simple thing of all is, well, what's causing the pain?
What causes it?
If laying on your left side at nighttime causes this pain, lay on your right side. Let that other side rest a little bit, along with, you're at office work and you're enjoying taking the stairs. However, now you've got this bursitis. Take a couple days off. Those 20 flights of stairs can cause a bursitis. That's that repetitive overload motion that we want to decrease the cause so that you don't have the effect of the pain.
Yeah. It's only one step into this office, Lonnie. You'll be all right.
I can make it.
You can make it. Yeah,
I can make that.
The cause is a huge factor. Absolutely. And then also a big thing there, he talked about instead of using the stairs to use the elevator temporarily, find temporary relief. Ice packs are great with that, right? Ice packs are a great way to remove the inflammation and really allow yourself to recover more efficiently and get the comfort you need to even get a good night's sleep. And so,
bursitis, it's a medical term of it. That last portion, itis, means inflammation. Ice is great for inflammation, calms everything down, gets you able to move with less pain and more comfort.
Yeah, and then also to get temporary relief, temporary use of an assistive device. This could be as simple as a cane just to help get you through the house more easily, get pressure off of that hip. The same thing with a walker. If you actually have both sides affected, use a walker. Get as much help as you can. The big push there is to make sure it's temporary. It is not a permanent fix. That is a temporary relief because you need to rest it while knowing what causes it.
The good thing is the bursitis is very treatable, and we call it a self-limiting condition, which means it's going to be okay on its own more than likely. But you can help speed that process along with a lot of the things we talked about at home to give you some great relief.
Yeah, it's all about shortening that amount of time that you have the symptoms, because the longer you have it, the more limiting it is. And a lot of times the worse it can get. We don't want to see it get worse.
And we see this with one side if you have bursitis on the left side. So what you end up doing is putting more work on the right side, which means in about a month or two, your right side is now going to be inflamed. So this back and forth is something you really want to prevent.
Yeah, no good deed goes unpunished.
I got you.
Yes.
But if you tried some things at home and now you're like, well, let me seek out some expert advice. There's a couple of things that you can see if you went to like your primary care or an urgent care. You know, the first thing they're typically going to start with is an NSAID. That's a non-steroidal anti-inflammatory to bring down some of that inflammation. Right?
Inflammation is very important for the healing process, but the longer it's there, the less helpful it is. We need to make sure we get that inflation out of there. So
and
this is
you talk about the longer it's there, we need to be careful with NSAIDs. You know, the longer we take those, there should only be a 3 to 5 day window for those. Anything longer than that, we run the risk of being one of the 85,000 Americans a year that die of NSAID use just because it will actually eat an ulcer into your stomach.
It will. It will. And then also, one of the things to help with temporary relief is actually a steroid injection. Directly in that area, a steroid is a natural, or not a natural, but it is an anti-inflammatory. And so it does have anti-inflammatory properties to give you the relief that you need to allow you to function the way you need to.
This is one of those kind of quick, short fixes that have great relief for the patients. You know, we just want to be mindful as far as if you're a diabetic or if you're immune compromised, that this may not be one of the options for you.
Correct. It can affect the immune response there.
Which is great. There's other options. I know we have some great things that you see in some specialty clinics that we're going to talk about as far as what the cause is, as far as how we can help that so that the effect is not prolonged and you get great relief.
Yeah.
And the cause could be that you're misaligned.
Yeah.
So what do you need to do?
Get adjusted. We need to adjust the spine. We talked about the feet being the foundation. So anytime the feet are affected, the ankles are going to be out of line. The knees are going to be out of line. It's just a trickle effect. The hips get involved, obviously. And then the low back, it's just a trickle effect. We need to align the spine, get that adjustment done to make sure that we have the best mechanical movement, the best function that we possibly can to recover from this more efficiently. And then also rehab. As we get better aligned, we need to continue to strengthen. range of motion is so important when it comes to any joint movement. We got to get that movement in there. So we need to increase range of motion with stretching, and then we need to strengthen with very specific and strategic muscle groups and exercises to get that progress and strength back.
Muscles are what cause this, that overloading, and now increased pressure on that bursal sac has caused it to become inflamed. So what you want to do is make your muscles strong so they're not overloaded. They need to be strengthened to do the activities that you want to do.
Yes. It's all designed around that. And then also decompression, believe it or not, is a phenomenal stretch to get the best amount of movement from the pelvis and the hips. It's a great stretch for the hip joint as well as the low back. They work very synergistically together. And so decompression is a phenomenal tool and something we incorporate in most of, if not all of our treatment plans to get that hip back where it needs to be and get the function that's needed.
Yeah.
Yeah.
And then, of course, there's some other things, especially when we look at the regenerative medicine category. The number one thing that we see for hip bursitis that is phenomenal is actually platelet-rich plasma. So there's actually a PubMed article, and it's not necessarily an article, it's a systematic review of other studies. So what this study did, it took a whole bunch of other studies, compressed the data into one conclusion. And the conclusion was platelet-rich plasma has a very significant or great outcome at 3 months based on other treatment options, and a significant improvement at 12 months based on other treatment options for hip bursitis.
That was just a whole bunch of good news right there.
Easy, it's your own blood.
Yep.
It's a natural way to help that inflammation with significant improvement over other treatment options, not just on its own, but over other treatment options.
That is great. That is wonderful news. That's really cool. That's a very great article. So yeah, that concludes
Hip bursitis.
our Medical Monday on hip bursitis. I hope that everybody learned something today. If you experience hip bursitis, do what you can at home. And if you need some help, know that we're here. And there's a lot of other offices as well, a lot of options out there. So thank you so much for joining us. Happy Monday.
See you next Monday.
We'll be back next week. Oh, wrong mouse.
I don't even have a mouse for that.
I touched the pad. Oh, we're going to end the